Welcome to the LDN radio show, brought to you by the LDN Research Trust. I'm your host, Linda Elseygood. I have an exciting lineup of guest speakers who are LDN experts in their field. We will be discussing low-dose naltrexone and its many uses in autoimmune diseases, cancers, etc. Thank you for joining us. The LDN 2018 conference will be held on the 7th of July in Glasgow. It will be live streamed and recorded, enabling people to attend virtually around the world, as well as those that can join us in person. Visit the website www.ldn2018.com for further details. The LDN 2018 early bird discount is available until 22nd of March. And you will receive 25% off all live stream recordings and tickets. We do hope that you'll join us. Today I'm joined by Dr. Pamela Smith, who is currently in Mexico. Welcome, Pamela. It's good to have you here with us.
Well, thank you very much. Glad to be here today.
Well, thank you for taking the time to talk to me. Could you tell me your background? When did you get into medicine and what have you been doing to date?
Well, in this June, I graduated from medical school 40 years ago. And so for the first 20 years, I was an ER physician in a level 1 trauma center, which I very much loved my career. And then I had a small overlap with my second career in medicine, which is anti-aging, which I've been doing for 23 years. I've been very blessed. I have loved both of my careers in medicine.
Mm-hmm. So when you, in your first career, did you encounter naltrexone? Was that something that was used?
I did. In my first career, we did use naltrexone for drug overdoses, and that's how I first came upon using it, and it works very well for that.
Mm-hmm. And it would seem to me people who have experience of ER medicine, or if they have a background of theatre, having worked in theatres, and they know naltrexone, it makes them more open to LDN, where some doctors don't know naltrexone and aren't interested in learning about LDN either. So that is a sad thing.
Well, I agree. And the other thing about it is now there's so many studies out that the medical literature, if you're reading it, really very interesting when it comes to low-dose naltrexone for weight loss and low-dose naltrexone for autoimmune diseases. There is a plethora now in the medical literature for low-dose naltrexone for that purpose.
Mm-hmm. And when did you first hear about LDN?
LDN is one of my very favorite things from the viewpoint of different things I use it for. I mean, autoimmune diseases, there's a wide range of the word autoimmune. Crohn's, multiple sclerosis, fibromyalgia, very important for all of those, and rheumatoid arthritis, great studies. And then if you broaden the term of what we use LDN for, you now see it used for cancer. You're seeing it used for Lyme disease. You're seeing it even used for irritable bowel syndrome and dry eyes. So it's being used for many things currently.
Mm-hmm. And of course, many pain conditions are using LDN, and mental health issues. And it just amazes me every time we have a conference, there's always something else that is new and different, that everybody's not aware of. I mean, and children use it for autism as well, and that seems to be very effective.
Well, it is. And part of that is just because in the lower dose, it is an opioid receptor agonist. And so it actually helps with the immune system regulate it. As you mentioned, it's great for pain control. And that's why it has such a wide usage. But I really think the biggest reason it has usage, and it's going to come out more in the medical literature now, is that low dose naltrexone is anti-inflammatory. And 90% of chronic disease is inflammatory in nature. And I think that's going to turn out to be its biggest usage of all.
Yes. And you were talking about using it in your practice for weight loss. How do you implement that? You know, what dose are you using?
Well, when we use low-dose naltrexone for any reason, including weight loss, this is how it's prescribed most commonly worldwide. You start out with 1.5 milligrams in the evening for 1 week. Then the next week you double that, so you're on 3 milligrams. And then in the next week, you are on 4.5. So you increase it by increments of 1.5. Mm-hmm. You can go all the way up to 6 milligrams. After 6 milligrams, then it really is not considered low dose anymore. In my personal practice, I only have one person on 6 milligrams. Everybody else is on 4.5. It's worked very, very well. The biggest possible side effect is insomnia. If that occurs, it usually goes away within 4 days. If it doesn't, then instead of having people take it before bedtime, we move it back and have them take it at 6 p.m., and that seems to solve the problem.
Mm-hmm. And what kind of success have you had with LDN? Do you have any?
I've had fabulous success from Parkinson's disease. Let me give you an example of a patient with Parkinson's disease in my practice. Mm-hmm. Financial advisor, makes his living with his brain. His speech was getting slower. His gait was changing. The main symptoms of Parkinson's disease. We did 3 things for him, which we do for all patients with autoimmune diseases like Parkinson's. We took him off of gluten. We improved his gut health, his gastrointestinal health, and we put him on low-dose naltrexone. And he is doing very well, extremely well. He's back to work, seeing his clients. It's fabulous.
Oh, how wonderful.
Probably my most exciting story of low-dose naltrexone is in a 25-year-old patient who came to see me recently. And she was in a wheelchair. And we did some studies on her, and she turned out to have Lyme disease. It was chronic Lyme that had affected her nerve endings. We treated her Lyme disease. We started her on low-dose naltrexone. And between the treatments for Lyme and low-dose naltrexone, which is now a treatment for Lyme, in 6 weeks, literally, she was out of the wheelchair. And in 3 months, she was driving a car and jogging.
Oh my
so
goodness.
You can, it's fabulous. You can have really wonderful results.
Yes. Well, it's, for many people, it's just life-changing, isn't it? What it can do. If only we could persuade all the doctors around the world to at least investigate into LDN. I know some of them just are not interested, but it's always so utterly amazing when you find a new doctor that you haven't heard of that's prescribing LDN, because we have about 80 people a day around the world who are asking for details for an LDN prescriber. And you mentioned Lyme disease there. I mean, that is becoming so... I'm trying to find the right word. It's everywhere, isn't it? Everybody knows everywhere. Somebody now who's got Lyme disease. And those numbers just keep increasing.
At the American, it does. And at the American Academy of Anti-Aging Physicians, we have a fellowship program which is very unique in the world, where we train physicians in an anti-aging and functional medicine approach. And in Module 6 of the fellowship, a good portion of that is now the treatment of Lyme disease. And we're very privileged to have world-renowned professors teaching it, because you're right, we really need to get all doctors on the same page when it comes to LDN.
I mean, I have spoken to so many people with the Lyme disease. I have MS, and I was really ill, and I know lots of people with MS who are really ill. But people with Lyme disease, it seems to be like MS plus other things as well, if you know what I'm saying.
I do.
It's just awful, and it's heart-wrenching when these young people, I mean, we're talking from 10 upwards, who can't go to school, who can't function, can't join in, their lives are totally devastated, and it's so awful for the parents of these children who want to help and don't know what to do. And it would seem standard Western medicine doesn't really know what to do with Lyme disease. You have to look for a Lyme literate doctor to find the answers, don't you?
You do. You do have to look for a Lyme literate doctor. The same thing occurs right now with LDN, although I was very blessed last year to be invited to speak at an international conference on conventional medicine, just looking at new therapies. And I did get to give a talk on LDN, and it was a workshop. Yeah, and it was a workshop, and I was surprised because there was 11 other workshops running at the same time. So I thought, oh gosh, people may not come to the workshop, but they did.
Really?
The room was full. It was standing room only. We even had people sitting on the stage. So I do think that we are starting to now get people to understand that low dose naltrexone is great for a myriad of things. And now we're starting to get people to understand that Lyme disease is not just a disease that, occurs when you get bitten by a tick, but that there's secondary and tertiary Lyme. And the other thing that people don't realize about Lyme disease is that it's sexually transmitted. And so like its cousin syphilis, which is also a spirochete, people can get it from sexual intercourse. So there are other ways besides being bitten by a tick.
Well, that's it, isn't it? I mean, there are babies being born with Lyme disease. I mean, and that's just beyond my comprehension, how you would deal with such a small child having Lyme disease. If you had a baby, how would you know this child had Lyme disease at a very early age?
That one I can't answer, unfortunately, because I don't see children in my practice. I start seeing people at age 14, so that one I don't know the answer to.
Okay. Because it would be amazing, wouldn't it, to be able to know what to look for and how to treat them so that they didn't become sick in the first place. That would be just amazing.
Well, the other thing with Lyme is it is now in the medical literature as a known cause of Alzheimer's disease. That is now published.
Really?
And so every one of the patients who come to see me for memory, because let's face it, it's vision, memory, and mobility as you age. Every patient who comes to see me for memory, I do a Lyme test on. And it's been amazing how many of them have positive Lyme tests.
Really? Now, as I said, I have MS, and I've been told that maybe I have Lyme disease. I don't know. I've never been tested. Have you found many people with MS who have Lyme disease?
Yes, we have. And I have a large MS practice because my personal practice is in Michigan, which is in the northern tier states of the U.S., where MS is, as you know, much more common in people who live in northern latitudes around the world. And because of that, I have started testing people with MS for Lyme. I also test them for chlamydia, and I also test them for mold. And it's been amazing that a number of patients with MS have had one or all three of those disease processes.
Okay. If you had to give a time frame on average for someone with MS, I know you mentioned about the lady in the wheelchair, how long would you expect a patient who comes to see you with chronic Lyme to start feeling better?
The younger the patient, the faster they feel better usually. Mm-hmm. But it will also depend on what part of their body is affected by Lyme disease. So the cardiac, meaning the heart manifestations, and the neural manifestations, the neurological ones, take longer to work, and memory takes the longest. So it can be years before some people do better.
Okay. And what about putting it into remission? Is that a possibility? Do you manage to get many people into remission?
We do. We have several protocols that we use developed by Dr. Richard Horowitz, internationally known Lyme expert, teaches in the fellowship, and he is really the best out there. Mm-hmm. And he has just been remarkable in really developing protocols that are effective. And it's not just taking care of Lyme. Lyme is very tricky, the spirochete is. There's the cystic form, there's the cellular form, and there is really the part that gets into the biofilms. So it really is kind of everywhere. So it even gets into the gut, and you have to treat the intracellular, the extracellular, meaning in and outside the cell, and you have to treat the cystic forms. So I kind of call the spirochete that is Lyme disease, I call it a Klingon. So if people are Star Trek fans, it cloaks itself. Mm-hmm. And so it can be very tricky to get rid of.
Wow. I don't know, you may not be aware, but we filmed a Lyme disease documentary last year. It's now being completed editing, and in the next couple of weeks it should go live. And we had Dr. Richard Horowitz interviewed on there. We interviewed so many Lyme doctors. It was amazing. And we put together an hour-long documentary. Plus, we're going to have 30-minute interviews from everybody who took part, because everything they said was of value. And of course, if you've got 8 people and you've only got an hour, you can only have certain snippets. So we thought to honour these doctors that were talking about Lyme disease, to give them a half an hour each as, added material. So that should be helpful.
Oh, I can't wait to see it. Excellent.
Mm. So we're trying. We are trying. Now, the American Academy of Anti-Aging Medicine Conference, the A4M, which is in April. Could you tell us, it's called Brain Awakening, and it's April the 13th to the 14th in Hollywood, Florida. Could you tell us what the conference is about, what's the aim, and what people are going to learn? And you also said it is open to the public if they wish to attend, and also mainly it's for prescribers. So if you could tell us what it's about, please.
Well, it really is about brain awakening, brain restoration, brain fitness. It really is all about memory, and really memory and focus, all of those things, because if you don't have memory at any age, if you don't have focus at any age, it's hard to have optimal health. Dr. Daniel Amen will be one of the keynote speakers. He is not only a brilliant physician, he's a personal friend. He is one of the most kindest people I know, and he is a very entertaining speaker. Mm-hmm. Sometimes speakers can be very good, but they're not always entertaining. He has all of those. Rudolph Tansey, Brennan Spiegel, Ron Kaufman, Arlene speaking, which are all world-class MDs and PhDs. So if people are attending the 26th Annual Congress at A4M, they're in for an absolute treat.
Mm-hmm. People with MS and fibromyalgia, chronic fatigue syndrome, have a symptom, not always, but can have what we call brain fog, where it's really, really difficult to think, clearly, which is awful. I had it myself, and it's unbelievable. Would that be covered in this conference?
Brain fog is absolutely going to be covered in this conference. Also in this conference is going to be covered is hormones and their relationship to health. Mm-hmm. Because one of the key ways to maintain memory and focus at any age is to be hormonally balanced. And when it comes to MS, there are studies in the Journal of Neurology and other traditional medical journals showing that estriol, which is a kind of estrogen, otherwise known as E3, is actually now part of the standard of care for MS for both men and women. So yes, all of that's going to be discussed. The seminar on hormones and memory happens to be the one that I'm giving, and it will be highly entertaining and very, very informative.
Mm-hmm. You mentioned diet before, and gluten and dairy, processed foods, all of these things we're told are not healthy, and processed sugars. What would you say that is on the brain? Does that affect the brain?
It does. How you eat affects everything there is. That's going to be discussed at the conference as well. Sugar is literally a toxin to the brain. Mm-hmm. They did a medical trial, and they had little laboratory animals. They put out 2 bowls. They put out 1 bowl of cocaine. The other bowl was sugar. Sugar is so addicting. It's more addicting than cocaine. Almost all of the laboratory animals ran to the sugar bowl and not the bowl of cocaine in it. Mm-hmm. Great book out there on sugar by Nancy Appleton, who's a PhD nutritionist. It's called Lick the Sugar Habit. She wrote a second one called Suicide by Sugar. So sugar causes inflammation. Mm-hmm. So from the viewpoint of diet, we really want people to try and decrease and avoid as much sugar as possible.
I can remember seeing a picture of a pile of sugar, like a mountain of sugar, and on it had skull and crossbones.
Exactly.
And it was...
In fact, that's what I teach my patients to do that. I think
you
need to envision it as a skull and crossbones, particularly if they have gut disturbances, particularly if they have autoimmune diseases, they have diabetes, they have cancer. Sugar feeds cancer cells. Mm-hmm. We all get cancer, probably 8 or 9 times in our lifetime. If you have a good immune system and you don't feed the cancer cells with sugar and you have less stress, then you kill off those cancer cells. So even when it comes to cancer, sugar is a no-no.
Mm-hmm. And what I can't understand, everybody really should know about sugar feeds cancer cells. Yet if you look at processed food, canned food, frozen foods, ready meals, all of these type of things, they are all so high in sugar. Even savoury food has so much sugar in it. It's just unbelievable. If the governments around the world all got together and tried to reduce the sugar, it would have to be done slowly so people didn't notice. We have nutritionist Jill Brooke who works with us, and she was saying your taste buds only live for 2 weeks. So if you can do without sugar for 2 weeks, you can break the habit. You don't have to be addicted to sugar all the time. But surely...
Oh, no. And
we could...
A lot of that has to do with stress. A lot of times people eat because they're stressed. Sugar. They eat sugar when they're rewarding themselves. And so there's a psychological component to eating sugar in particular. Mm-hmm. And so if we help people with a psychological component and that they use good food as a reward and not sugar as a reward, then we would get a lot farther as well.
Yes. I mean, I don't know if you can have sugar-free chocolate, but people should look, companies who make food should be looking at not just lowering sugar, but salt as well. I mean, we're having far too much salt in our diet. I don't take salt at all now, and if I go out for a meal, 9 times out of 10, it tastes far too salty for me because I'm not used to it.
Well, a lot of the restaurants worldwide now are removing salt and pepper shakers from the table. They come around with pepper, but many restaurants now no longer have salt. So, and speaking of diet, since you have MS, I know you know, but probably the people listening today don't know. If you have MS, diet is really important. It's not just sugar, but the Schwank trial, which has been going on for 70 years, shows that people with MS should never have dairy, and they should not also eat red meat. And so for people with MS, diet is a bigger issue than it is for everybody else.
I found I felt so much better when I stopped having gluten. I used to have acid reflux and had to take a medication for it. I can't even think of the name now. And if I didn't, the acid reflux was so bad at night when I laid down, I used to vomit. So hence why I took the medication. But once I'd stopped taking the gluten, the acid reflux just went. It stopped. It was eliminated. So I then
absolutely
risking, do I need to take this tablet? And I thought, well, I'm a big girl. If it still is a problem, I can take it again. But it didn't, and to this day, touch wood, I don't have any problems with acid reflux. And that was down to gluten. Obviously, I was so sensitive to it, it caused that problem.
Absolutely. MS being an autoimmune disease, all autoimmune diseases, no gluten at all. And patients just like you have experienced will do better. But you're right. Their irritable bowel, their reflux, all those things get better too without the sugar.
Yes.
Without the gluten.
It's difficult though when you first go gluten-free. Every single thing you buy, I like to use tomato puree. So there you are reading all the labels to make sure there's no gluten in it. And it's amazing what they put wheat in. I was looking at some oatcakes. Now, oatcakes you would think were made from oats. What was the main ingredient? Wheat.
That's why in my house there is one box, literally. In my kitchen, there's medical journals and there's pots and pans. I have one box because things in a box commonly have gluten. My one box is steel-cut oats because it doesn't have gluten. It's the only box in my kitchen.
Well, I think it's just as easy to cook from scratch, fresh food. You know what's in it, and I always cook enough and freeze it so I don't have to cook every day. But I enjoy cooking, and it's you know what you're eating if you cook it yourself. And I use spices and herbs and that kind of thing, and that doesn't affect me. So we're good. And I use
That's
olive
perfect.
oil. What do you cook with?
I cook with olive oil as well, coconut oil, depending if it's going to be higher temperature. I use a lot of herbs as well. And probably my favorite thing to spice with, quote unquote, is cilantro. It's so great. It detoxes your body. So I will get organic eggs and I'll put some onion in it, some tomatoes, some cilantro. Oh, it's fabulous.
Unfortunately, I've been tested and I'm intolerant to eggs, and I loved eggs. So I've had to give up eggs as well. I used to do fancy omelettes, but that's not possible anymore, but still.
Well, one of the things that eggs has in it, if you're not taking in eggs, is phosphatidylcholine. Phosphatidylcholine is very important for what we call membrane stabilization. meaning stabilization of the cell membranes. And that's very important for myelination and people who have myelinating diseases like MS. So if you can't eat eggs, or anybody else in the audience that's hearing this can't eat eggs, take a supplemental phosphatidylcholine. Very important to stabilize membranes. People do much better with membrane stabilization.
Well, thank you for that. I'll look into it and buy some. Yeah, okay, thank you. I like garlic as well, and onions, and it gives flavour, doesn't it, to food. And I also like oregano, and I have some oregano oil capsules which I use instead of antibiotics when I have problems with urine infections, UTIs. I find that works very well.
Perfect. And if I'm in a plane near somebody who's sick, I will go when I land. I go and I get some garlic. I will go to whatever hotel and ask for some raw garlic. Mm-hmm. Yes, I may need breath mints, but garlic kills everything. It does. Garlic kills parasites, kills fungus, it kills virus, it kills bacteria. Garlic is a natural healer. I love garlic.
If you think of years ago, before Western medicine, that's what people used to have, isn't it? All the herbs, and when they would walk out into the woods and whatnot and collect all these, probably they would call them witches, who gathered all the different potions and lotions that they used to make. But people didn't always need Western medicine to get better back then, because there wasn't any. But mind you, people used to die much earlier in life than they do now. So I think we probably need something.
I totally agree. It's unfortunate, that we do sometimes need more, but I believe in traditional medicine. I truly do. I'm a very traditionally trained doc. I just have a bigger bag of tricks in being able to look more at the cause of the problem and not just treat symptoms.
Wonderful. Well, thank you for being our guest today. We've now come to the end. And if any of our listeners would like to go to the conference, The Brain Awakening, April 13th to the 14th in Hollywood, Florida, A4M are offering our members a 25% discount, and the discount code I will put online. And once again, Dr. Pamela Smith, thank you so much for having joined us.
Thank you so much. Have a great day.
Thank you. The LDN 2018 conference will be held on the 7th of July in Glasgow. It will be live streamed and recorded, enabling people to attend virtually around the world, as well as those that can join us in person. Visit the website www.ldn2018.com for further details. The LDN 2018 early bird discount is available until 22nd of March, and you will receive 25% off all live stream recordings and tickets. We do hope that you'll join us. Any questions or comments you may have, please email me, Linda, Linda, at ldnrt.org. I look forward to hearing from you. Thank you for joining us today. We really appreciated your company. Until next time, stay safe and keep well.